Welcome to the Secrets to Mindful Health, where we explore the hidden truths of wellness in all its forms. From physical and mental health to spirituality, join me, your host, Beth Warren, at Nourished by Beth on Instagram and TikTok, registered dietitian for over a decade and single mom of 6, as I share my personal journey overcoming challenges towards self-love and wellness. Together with my guests, we will inspire and motivate you to prioritize your well-being and create a life of balance and fulfillment. Let's embark on a transformative journey towards a healthier, happier you. I'm glad you're here. On this episode of Digestive Delights, navigating GI health for tiny tummies, I'm thrilled to have the esteemed Dr. Rebecca Windermann, a pediatric gastroenterologist, as our special guest. In this episode, Dr. Windermann will share her expertise and insights on gastrointestinal issues in pediatrics, providing valuable tips and strategies for supporting your child's digestive wellness. Get ready for a fascinating conversation that will leave you feeling empowered and informed about your child's health. Dr. Rebecca Windermann is a double board-certified pediatric gastroenterologist who combines traditional medicine with a holistic, lifestyle-based approach to treating children's gut health. Dr. Windermann has recently launched a thriving private online practice specializing in constipation and digestive issues, and is the creator of the Comprehensive Constipation Program, designed to help families tackle chronic constipation in children. As a prominent social media health influencer, Dr. Windermann reaches over 500,000 followers across platforms like Instagram, TikTok, and YouTube, providing valuable insights on pediatric health. She was also selected to be part of the White House Healthcare Leaders on Social Media Roundtable. Prior to relocating to LA and focusing on her telehealth practice, she served as the director of pediatric gastroenterology at Jamaica Hospital and Flushing Hospital in New York. Welcome, Dr. Windermann.
Hi, thanks for having me. I'm really excited.
So excited. I'm excited anyway because I just, we've chatted before. It's always like a pleasure even just talking to you, and you bring such an aura to your social platform that just makes people very comfortable to talk about like poop issues and things that otherwise might be a little bit like secret.
Yeah. I always tell my patients I'm a poop doctor. I just to warn you, we're going to talk about your poop. So hopefully
right. I mean, yeah, it should be obvious. But also, I'm so excited to have you because as I'm in my own private practice with nutrition, and I see pediatrics and adults, and I think I said constipation like 4 times in your bio. Like It is, I mean, I'm assuming one of the biggest complaints people come in with, but what is it about constipation and why is it so humongous of an issue?
Yeah. So thanks for asking. So basically, the issue with constipation is different in all age groups. So, I would say about 80 to 90% of my patients that I see in my practice have some form of constipation, whether we know it or we don't, and we discover it in our session together. But it is such a huge role in my practice because for good reason. Kids experience it and at different ages. So, when we talk about potty training time, that's a really prominent time for kids to start withholding stool. And I see, patients in that age range suffering because of that. And then you get into like school aged kids who issues with constipation because they don't want to go in school. They, nobody really wants to poop in school. And then you get, the sort of teenage years where we're talking about, okay, we're not eating enough fruits and vegetables. We're not drinking enough water. And so diet plays a bigger role in that. And then you have patients who have chronic diseases, leaky gut and autoimmune diseases, who most of the times the first thing to get hit, or even possibly, the chicken or the egg where it started, is that motility in their gut. So it really all starts with how you move things along. And I think the more literature that is coming out, the more people actually are starting to pay attention to what's in the bowl.
Right. And how do you get to the bottom of it? Like when somebody comes to you and they're like, or do they even know that what they have is constipation? And because with kids, it's like they can't really express, or something so normal to them because they've always had it, or people, even adults assume that constipation is normal. They'll select it on a chart.
Yeah.
So how do we get to the bottom of helping them understand that it's a problem and then why it might be the case?
Yeah. So I'd say the majority of people that come into my clinic have an understanding that there's something going on with their poop. But I will say that there are signs that maybe you wouldn't think are related to being constipated, like having stool accidents. I see that all the
Mm.
time. And parents are, and I tell them, oh, and they say to me, every day having accidents in the pants, and every day coming home and telling me, I don't know when it's happening. I'm not doing it on purpose. And parents are so frustrated. And then they come to me and I tell them, oh, this is from being backed up. And they say to me, what do you mean? It's liquid. It's not backed up. It's diarrhea, And so it's like, and just having to explain to them, like, actually there is constipation behind that. So I would say, the majority of patients in one way or another have some sort of stool issue going on, whether or not they see it directly or not is sort of like what I help parents do. But I would say that, if you're coming in and your kid is a school-aged kid, the most common cause of abdominal pain in a school-aged child is constipation. So it doesn't hurt to take a look in the toilet. That's the first
Right.
thing I always tell parents. So that's, one and all. The second thing is, are the stools hard? Obviously, that's an obvious one, right? And so we start to talk about how often they go. And then when, I get the parents that are like, well, it's normal, just like you said, and we have them point out on the Bristol stool chart and it's not normal, it's hard and pellets. And then we have, the frequency. Parents are like, they go every day, like it's fine, but it's not really about frequency when we deal with constipation. It's about consistency. So if the poop is hard, then you're constipated.
Right.
So, it's nuances of medicine, even urinary accidents can be a sign of constipation. So I think it just affects so much that patients end up in my lap and we tease through those things together.
Yeah, I was even going to mention one. I also don't really hear one alike case of why someone might have constipation. I mean, from a dietary perspective, which we'll talk about, it's usually consistent
Yeah.
because a typical
Yes.
kid's diet.
Yes. Across the
But
board.
at the same time, like from a medical perspective or something more going on, it's different. Actually, I recently had a client who was having the urinary accidents and at night, and they were saying that he's constipated.
Yeah.
But then the mother would express that sometimes he would go twice a day or, multiple times. And then I feel it just, I don't know, you tell me if it also then becomes something, I'm not sure the right word. I don't want to say psychological or something then that develops into like more of an issue, or maybe because, now the child, I think, is about 10 years old, like they get older with these issues and then it becomes something they overthink.
Yes. So, and that's something I tell parents and families alike. This doesn't get better on its own. And in fact, it will continue to happen more frequently and become more of a psychosocial issue as they get older. So it's one of those things that you want to address right away, whether you come to me for, even just like a 15-minute quick consultation and I tell you, I put you on your way, or you go in to see your pediatrician or gastroenterologist. It's important to bring this up now because while it may not seem so important that they're having some hard and frequent stools, that develops then down the road into now I'm having accidents, stool or urinary accidents. And the truth of the matter is that unless you're fully cleaned out, neither of those are going to help. The colon sits right on top or behind the bladder. And so when the colon is stretched out and it has all the stool in it, there's less room for the bladder to have urine in it. So, the most common cause of bedwetting, of daytime urinary accidents is constipation for good reason.
Wow.
Anatomically, they're not hopefully not connected, but they are very close in proximity. And the same is true, with something called encoparesis. I see this all the time. It's poop accidents, and it is mortifying. And it is these kids who are school-age kids and parents who are frustrated, who are like, I don't know what to tell you. I give them fruits and vegetables, and all day long the school's calling me that he has that, and the kids don't want to be his friend because he stinks. And and it's terrible. And it's really it's both of those are involuntary, and the stooling accidents happen because the kid is so impacted that the new stool that comes down, the liquid leaks around it and the solid stays behind, and the kid has no idea. And it is true, they're not doing it from a behavioral standpoint. And it's one of those things again that just doesn't get better on its own, and the longer we let that fester, the more psychosocial damage that gets done. And I feel bad, these patients are often going to urologists and waiting 6 to 9 months for a gastroenterologist. And so I decided to really bring this to light because it's just such an issue. And you really are only school aged once, and
Right.
that is your childhood that you go to therapy for years
Right.
down the line. So, if I can help, patients and families work through this, that is my goal. But yes, to answer your question, it doesn't get better on its own.
Yeah, like to sort of nip it in the bud and just be like, oh, it's not just a constipation issue, like it's not something to deal with, but it's pretty straightforward in terms of just sort of like get in the door, nip it in the bud, take this course, and that's what I wanted to talk about is sort of like the first line defenses, even though we're saying people might have different reasons why they
Yeah.
have constipation, like sort of, is there a common like first line thing to do, acute, chronic?
Yeah. Yeah, I would say, look, like, obviously each person, like you said, each person's treatment plan is a bit different. And I do help patients to put those together. But first and foremost is sitting on the toilet. Like
Mhm.
having your kids sit on the toilet for 5 minutes in the morning before school and 5 minutes after school is, I would say, akin to like the best drugs out there, like acutely, and having them do it consistently. So parents that want to avoid medications, the first thing I tell them is, first of all, if it's not an ongoing issue and everyone's a little bit different, everyone should be sitting on the toilet for 5 minutes before they leave the house and 5 minutes after when they get back from outside. Nobody wants to poop outside, and this really gives you the best chance to evacuate inside the house so that you don't have to do that outside. When you start to go to school or you start to go to work and that urge comes, we all have the ability to withhold it. And so, yeah, it's not an issue because we'll just poop when we get home, but oftentimes that doesn't happen. So,
Mhm.
it's important. And your colon's awesome. It's an awesome organ, but it doesn't have a shutoff valve. So like its job is to, bring out, absorb water from it. So it's like the longer it sits there, it's like clay, like doesn't get any softer. So sitting on the toilet is probably the most, efficient way to start treating constipation at any age. I would say just as important is not using your phone on the toilet. It is so
Mhm.
important because the truth of the matter is you're there to go to the bathroom, and your gut and your brain are connected. So if your brain is on the phone, your gut is on the phone. It's not doing its job. And so you really have to just, listen, I say 5 minutes for a reason. You shouldn't be on this toilet at any age for more than 5 minutes. I mean, when
Mhm.
we're older, hemorrhoids, when we're younger, we learn that the toilet's not for pooing. So it's 5 minutes. If you don't have to go, you get up, use your phone in another room, lock the door. I
Mhm.
don't care if you want time away from the kids, get off the
Right.
toilet, sit on the floor in the bathroom and use your phone. Like
Right.
your colon like needs you to like comply with it. So that would be the first and foremost thing I would say is behavioral stuff.
It's like when they say, which we'll talk about, eat fruits and vegetables. It's like, but why do we have to be told that? Like, how do I avoid
Yeah.
diseases? And then
Yeah.
people aren't doing it. And I hear also from like a breakfast perspective or whatever, how hard the mornings are. So it's
Yes.
crazy how much we don't have 5 minutes in the morning. But I always argue like sleep is sort of like the first thing to work on with kids because the ones who
Exactly.
can't wake up, it's because they're sleeping too late and everything's delayed. Even their ability to go to the bathroom is delayed. So,
Correct. And the best time to poop is 20 minutes after you eat. So I always tell parents, I'm like, look,
mm,
kids will get up and go to bed like when you tell them to get up and go to bed. So like it's most of the time it's like parents, it's me that's like waking up late and frantic and throwing things into the lunchbox and get out the door, get out the door.
mhm.
So I think like, the thing is like we have to, set them up for the best chance of success. And the best way to do that is to get in breakfast in the morning. So I always tell the parents, I'm like, listen, wake them up, have them come sit at the table, eat, brush their teeth, go get dressed, and right before they leave, 5 minutes on the toilet, and that's it, and go off on your way. And that in and of itself, 20 minutes, it's like, everyone knows after they have their breakfast, about 20 minutes later, we're in the bathroom. Why? Because
Yeah.
the body's emptying, right? It's like, oh, I gotta make room. Like she's had something to eat, and it moves things around and the motility gets going. So it's like, how we're going to start our day is how we're going to experience the rest of our day. And that's true in mind, body, and soul. So yeah, it's important.
Yeah, it's so true. I'm thinking of my checklist in the morning. So I have 6 kids. So it's funny because my youngest is now 5, my oldest is 17. I sort of missed the boat on some of them, but I'm thinking of the run through, every morning it's like we don't stop. And even my kids get crazy. They're like, Mommy, tell us every morning. Like, I know to make my bed and pick up the clothes off the floor, but I'm just thinking of the checklist I run through every
Yeah.
morning.
Yeah.
And I sometimes I say, do you have to use the bathroom? But now, like, I'm going to put that in there as like, oh, go, or I'll say, go use the bathroom, especially with the younger ones, because the younger ones especially value the cues. They value them. Whenever I say, oh, do you have to use the bathroom? Then suddenly, like, yeah,
Yeah.
and they go
That's
and they use
a
it.
reminder. They're very
Yeah,
busy at school
they're,
age, right? And
they're
that's
very busy.
very
So
busy.
I'm going to say it. I don't know if I say always that one consistently. I'll say brush your teeth. And isn't that funny? I think that's funny how we prioritize things
Yeah.
like, oh, brush your teeth. For me, of course, it's eat breakfast.
Yeah.
And then I never thought, and I'll say go to the bathroom, but it's more to avoid a pee accident on the bus
Right. Right.
uncomfortably. It's not
Yeah.
like, oh, let me help your stool hygiene, your poop
Yeah.
hygiene, and go
Exactly.
sit on the toilet. That's such
Exactly.
a good, obvious one. Okay, so then what would be next? Because I know a lot of people get put on Miralax for, I
Yes.
guess, extreme situations with the doctor's,
Yeah.
treatment plan, and then they also have a lot of feelings about it,
Yeah.
and so do kids.
Yeah, yeah. So the thing is, okay, so the Miralax thing, I will be completely transparent. I am a big fan of Miralax, but in certain scenarios and for certain lengths of time. And I see far too often parents who are put on Miralax, not the correct dose, not for the right amount of time, and they end up on it for years and or on
Mm.
months. And then they come to me and they're like, it didn't work and I don't want to do that. And so it's like, when you have an effective medication, not, and it's so often the case, pediatricians and even, myself, gastroenterologists, we don't always do the greatest job of telling patients how to take a medication or how to adjust the dose or what to look out for. And so Miralax is one of those like holy waters that like, oh, your belly pain is with Miralax and you'll follow the instructions, right? So, and it's one of those medications that it's the reason that we like it as physicians is because it doesn't get absorbed. And so whatever goes in comes out. Now there are concerns around what gets absorbed and if there's any other extra, material in there that, could be of issue. I will right now here tell you that I am a part of all of these mommy groups on Facebook. I have read all of their posts and I have heard all of the concerns and I am wildly well read on the topic. And I have yet to have seen a major study done that actually would prompt me or the medical community to stop using Miralax. However, everyone is different. And so when mom tells me that there's something going on or that, there's a behavioral issue, I listen because moms know their kids and not, large scale studies. So could there be an issue behind it? Yes. More often than not, the complaints I see on those Facebook groups are often that they were not given their correct dose and they've been on it for long periods of time and they're frustrated. And guess what? Constipation can also cause the symptoms that you're hearing about with the Miralax: behavioral, bloating, not helping, right? So if you're not on the right dose, constipation makes you bloated. It's the number one cause of bloating. So if you're backed up and you're not getting your stool out, I don't care what medication you're on, it's not working. So, and people keep their patients on Miralax for long periods of time because in general, it is a safe drug. But you are going to start to see changes because no drug should be used for long periods of time. There are certain exceptions here and there, the neurologically impaired, the kid with bad motility. Yes. But in general, there shouldn't be a Facebook group that big with Miralax.
Right.
So,
Right.
I think that's the first and foremost thing is that it's a great drug. It needs to be used in the right context for the right dosage and for the right amount of time. And that is not 6 months. So
Right.
that's really why I developed this program because I just saw so many parents just so thrown around and tossed around by the program. And it's like, well, we gave it for a week. That's what the ER told us to do. Well, that's not going to solve this long-term problem, right? So, or we gave a cap every day for a month and it didn't help. Well, that might not have been the right dose. So it's like just working and tailoring those things. But because it's such a safe drug, people get put on it for the wrong reasons and for the wrong amount of time. And it really does get a bad rep that's not founded in science. But again, I listen to parents. And I think that's also what separates me from the other slew of doctors out there is that like, I'm willing to figure out what's going on and work around it and give some other options as well. It may
Yeah.
take longer, it may taste grosser, but I'm willing to.
Right.
Yeah.
Right. Yeah. So I'm wondering if there's if it kind of could stop there for most people, and then how diet interplays in all
Yeah.
this.
100%. So the thing is, with school age children, it's a lot of withholding, but even then, and so with, as you get older, like the teenagers, it's more diet based. They're not really withholding their stool. They're just eating garbage. But
Hmm.
either way, from birth until, teenage years, it plays a role. So you can give as much Miralax or stool softener because your kid is withholding. But once you come off of that, you're going to need fiber to keep it soft, because the
Hmm.
reason they were withholding is because they didn't have soft stool to begin with. So
Right.
diet is always going to be a part of my treatment and overall approach to anything. So eating things that are high in fiber, not fiber gummies,
Right.
is
Not
important.
fiber candy.
No, there's no quick fix. Like I was talking to a patient earlier today, and she was just like, I guess there's just no like one thing. And I was like, there's no one thing. You got to do all the things. And so when we don't
Yeah.
do all the things, we know we're like, I didn't work out today. I didn't eat enough fruits and vegetables. My pee's really yellow. I need to drink more water. Like, it's all the things that we have to
Yeah.
do. And I think, and nutrition is by far the biggest influencer on our gut health. So it starts with the foods that we put in our mouth. And we got to find ways for kids to eat those fruits and vegetables. I don't like to hide them per se. I like kids to know what they're eating. So when they go to a friend's house and they're like, oh, broccoli, da da da, they know, like, oh, I like broccoli, right? Like, and not like, no thanks. But, smoothies are a great way for me. And I tell
Hmm.
patients all the time, like, I tell moms all the time, you wouldn't believe how sweet a smoothie can get with a medjool date in it. Like,
Right.
it's like they won't even know it's in there. You don't have to hide it, but like there are ways to get the fiber in, and particularly I love smoothies for that reason. You can grab, how it is, like,
Yeah.
it's everything's freezer. Like, you buy yourself a $20 NutriBullet and you have like 39 plants in your diet immediately.
Right. And
Yes,
like we're saying, a lot of these same people don't have breakfast in the morning, saying there's no
yes,
time. So I say the smoothie, especially in the morning when they're running out anyway. You give them a smoothie, you get their servings of fruits and vegetables can be stuck in there. And I usually give parents also very simple, straightforward recipes. Sometimes they get too excited and they'll add like 12 fruits and it doesn't even
yeah,
taste good anymore. I was like, just
yeah,
this and that and
yeah,
like that. You could throw some chia seeds in there. Like, you can,
yeah,
there's so much you can do. And then you also cancel out this whole I'm in a rush in the morning. My kid doesn't want to eat. Okay, so drink something, but there's a lot of work. You see, I recently had a mom. Sometimes parents are skeptical about bringing their kids to see me. They're not sure, when you hear
yeah,
dietitian, which I love that they're cautious, because you might
yeah,
have very weight focused people you're working with or whatever. And I'm happy to meet a parent first if they want to come. I always quickly say we have to meet the child because the work
yeah,
is with the kids.
yeah,
But there's so much work to do with the parents, and that's my point. So I was speaking to her, and her primary work concerns were about, she was more expressing abdominal pain, but when I spoke to her about that, she said she has chronic constipation. So
mm,
so okay, but now the issue is that she's in so much pain,
yeah,
abdominally, and she was coming to me, I think, actually more about reflux, which some GI, a virtual consult, said for some reason flagged, while also asking for a 3-day stool test, so she didn't do yet. So she was just sort of like running to me,
yeah,
but I said reflux. I was like, what's so then, so I'm first addressing and listening to the medical like background and what's been going on, and then it's okay, so let's get into her diet, which is really my primary job. And I mean, I don't even know what to say. Like, I mean, all that's going through my eyesight right now is white. Like, every white, I don't even think any color other than
yeah,
white. So, and that's not even to say, like, on top of that, also the volume, by the way, which we could talk about. The
yes,
volume. She is overweight. She is a volume eater also.
yeah,
So, but that we already know, she's skipping breakfast. So, meaning these things escalate into each other. So then, therefore, you are overeating when you eat because you skipped so
right,
many breakfast and lunches. But the typical, like, unfortunately, it shouldn't be a typical kid's diet, but just very much into carbohydrates and simple carbohydrates, and bringing four plus snack bags to
Oh yeah.
school a day and coming home and eating. She was eating up until that week of seeing the GI, who did flag this, by the way, 2 full dinners. So not
Wow.
just a dinner when they get home, but a full dinner, and then another full dinner 2 hours later. Probably she was starving from not eating adequately all day.
Yeah.
And, oh no, but she's never going to touch anything for breakfast. And I just
Right.
like took a deep breath with her like that. And I said, you should absolutely go the medical route. You always should rule out whatever you need. You should always, and also now it's become a problem. So you probably
Yeah,
do need assistance. But
exactly.
this is largely related to her diet.
Yeah.
And you have
And that's
not one fruits and vegetables on
yeah.
there or anything other than a white grain and multiple snacks.
Which is like, right. So like, that's the thing, is that by the time, that's also why I decided to go into private practice, because, that's the first thing that I see then. And I see something where I'm like, oh, well, we have to treat you. And then, okay. And then we treat them. And then I bring them back. We have to have the discussion about, diet and how to keep this up. And it's like, well, if you saw me before for like preventative health, or if, your pediatrician had some more time to talk to you about it, or,
Right.
those kinds of things, it's like, you wouldn't really need to see me. Like 90% of your health starts at home. And I think sometimes parents need to hear it from a doctor. And, listen, if I had to go to med school for 4 years and train for the next, 7, okay, like I'm happy to do that. But I think, having come into the medical field, I started to realize, wait a second, like a lot of this could be prevented and
Mm-hmm.
can even be treated. And I think that's the cool part, is like, we've learned that like how big of a role diet plays in our health, and how we can sort of even offset a lot of that disease and chronic illness. So it's, for me, always a discussion about diet, whether you come to me for constipation or you come to me because you have, irritable bowel or inflammatory Crohn's, ulcerative colitis. We are always going to have a discussion about your diet, your
Right.
sleep, your anxiety levels. Like, this is how I practice. It's going to be a whole approach, because we're a whole body. So it matters. All of it matters.
Yeah, and it's so refreshing to see that. It's why I refer so many people to you, because
Oh, thank
your gut is your center of everything. We could treat one of the little symptoms and put a teeny tiny band-aid. I'm thinking of those like teeny band-aids. Do they even use this
Yes.
anymore? Those like teeny ones that
Yeah,
really
yeah,
don't
yeah.
cover anything except like one thing. But because there's so much, like you said, and even if it's developed into more like anxiety because of it, or I don't know. I just always find there's so much more to interplay, and so much more positive effect you can have by like being more open-minded about like everything this can be, versus like, oh no, it's just reflux. Well,
Yeah. Well, that is
what else?
part of it, right? But
Yeah,
yeah,
right. It's
it's
part of it. It could be happening, but there's more to it.
yeah, and
And
it's
it
how we got to it, right? So it's like,
Yeah, how we got to it. It might be something you always need medication. Like it's not even a medication
yeah,
conversation. It's just there's more going on. Like everything with the body hits each other. It hits something else. So
yeah,
first we're saying what you started off with, constipation, is that basically it cannot be left untreated.
correct,
No situations minimal enough to just ignore.
correct.
Right. And then once you even treat it, it's more like about treating or reminding people, like, also when you sleep, also look out when you travel,
Yeah,
watch when let's even like touch on like IBS and things like that, like trigger foods, and people might know things are hurting them, but they don't stay away from them, or
yeah,
whatever it is. Dairy also is another one.
yeah.
We're winding down now, but like when does it come to like food sensitivities with like gluten and dairy? Like when would you
Yeah.
start kind of touching on that with,
I would
or do
love
you?
That's a whole other episode
Yeah.
podcast. But yeah, we can quickly touch on it. 90% of the world's population is lactose intolerant. So yes, those are the big triggers for me, dairy. But more importantly than that, like it's about sort of keeping track of like, when I eat this, that happens, or when this happens, I had X, Y, and Z for the last day, right? Like that's the most important part, is because everyone's body is different. Sure, dairy is a big trigger. Gluten is a big trigger. Do you need to be avoiding those? Maybe you can try avoiding them for a week or two and see how you get on. But it's one of those things where people ask straight out if that is the problem, when, when I, and look, for me, it's like, I don't know if that's the problem. We just met in the last 5 to 10 minutes, but let's talk about like, what do you eat on a regular
Right.
basis? You know, like
Yeah.
what is your diet, right? Because like those are just pinpoint things you're asking me about. I don't know. Do you eat a lot of dairy? Well, not really. No, she doesn't like milk. Okay, so like,
Right.
probably not the issue, right? Like,
Right.
so it's one of those things where it's just like there's so many like flashy, you know, health influencers out there that are recommending you take this, that, and by the time people get to me, they're on like 39 supplements, paying like $1,500 a month, like trying to get things right, and it is not necessary at all. I mean, we can get down to the bottom of your health without avoiding every single food category and taking every supplement under the sun by just taking a look at what you're eating, how you're sleeping, how your stool is, right? Like we didn't have all this crazy fancy stuff before. And I think that it's people like you, people like me that are out there just trying to spread information about how patients can be self-empowered to do these things on their own and probably in a better way. Like I saw a patient, for instance, and I'll stop after this. I saw a patient that was taking a supplement and was but was completely avoiding dairy. And the supplement was dairy based, cow's milk protein based, right? So she was like, I don't get it. I avoided dairy, da 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 da. And I'm like, right, but this supplement that you're taking has like dairy in it. So like, is it dairy? Like, I don't know. Right. So it's those like little things, the nuances of like the hysteria around like food allergy and food sensitivities. Like we're seeing patients and kids coming up with like food aversions and stuff. Like easy does it. Like, let's just work together. You know, there's no fire, you know, and that's, you know, that's why, and I don't know if you see patients virtually as well, but like, that's why I started a virtual practice, because it's like 7 months to get into a pediatric gastroenterologist, and they're there, they come in with their Ziploc bags full of everything they've ever tried until they met me. And I'm like, oh my goodness.
Right.
You know?
And there's so much work you can do like this already to start.
7 months. Oh my God. A kid's, you know, kid for kid.
Yeah, so, for sure. Okay. Well, I'm so happy I had you on. This is so insightful. I'm even like super motivated. So how can people find you, work with you? What's your social handles?
Yeah, my social handles are Kids Gastro Doc. So kids like kids, GASTRODOC, Kids Gastro Doc. And you can book an appointment with me, just DM me. You can also go to kidsgastrodoc.com, and that would be a way to get in contact with me.
I think people are lucky this way. Like that you did this, I'm like, oh, this is great, because there's like full access. They feel like quicker access with you. And like you said, it's so hard to find a great GI, one that's like well-rounded and then be able to get in with, is like people need to jump on that. Yeah, so thanks so much for coming on.
Thank you for having me again. You're so sweet.
Don't forget to hit subscribe or follow me on Instagram and TikTok at Nourished by Beth, or listen on Spotify at the Secrets to Mindful Health podcast.